A mistake that almost every stroke survivor makes every single day, repeated again and again, and because of that one mistake the hand slowly becomes so tight and closed that later it is almost impossible to recover full movement. Today I want to talk to you about that one mistake. Most families do it with a very good heart. They think they are helping, but in reality they are quietly training the brain in the wrong direction. My name is Dr. Hartways. I work every day with stroke survivors and their families in India. If you or your loved one has had a stroke, if one hand feels weak or tight, this video is for you. Before we begin, I have a small request. Subscribe to this channel and turn on the bell so that I can continue to bring you clear and honest guidance for stroke recovery and your physical condition. And at the end of the video, tell me in the comments which exercise you are doing right now with the weak hand. Now let us talk about that famous mistake. You already know this exercise very well, the ball exercise. Almost every stroke patient receives a soft ball in the hospital. Relatives are told give the ball and ask the patient to press it. Even people who do not know the basics of medicine will say give a ball to press, it will improve the hand. The truth is ball exercises can be very useful for hand recovery, but the way most people do them on their own without direction slowly creates a serious problem. Let me explain in a simple way. Look at your hand for a moment in your mind. When you close your fist, the muscles that pull the fingers in are called flexor muscles. Flexor means closing or bending. When you open your hand, the muscles that straighten the fingers are called extensor muscles. So you have flexor muscles to close the hand and extensor muscles to open the hand. Now think about your daily life before the stroke. Most of the time in daily activity you were using flexion. You hold a spoon, you hold a mobile, you hold a pen, you grip a handle, you pick up bags, always closing and gripping. How often did you fully open your hand as wide as possible and hold it there? Probably very rarely. You closed the hand properly, but you opened it only halfway, maybe less. So even before the stroke, your flexor muscles were usually stronger and more trained than your extensor muscles. Now imagine two people. One is an athlete, physically very strong and active. The other is a person who avoids movement and exercise. If both suffer the same level of stroke today, who will recover faster? Naturally, the one who had better physical condition before the stroke, because the muscles, the heart, the lungs, everything is already stronger. The base is better. The same logic applies inside one single hand. Your flexor muscles have been trained and strengthened for decades. Your extensor muscles have been ignored for decades. After stroke, when the brain tries to reconnect, the first movement that often returns in the hand is flexion. The hand starts to close, the fingers curl, the fist becomes easier to make. This gives a lot of happiness to the family. Everyone feels that movement has come. Keep doing the same exercise. So what happens next? The family gives a soft ball. The patient presses the ball. The flexors work. They are already strong. They become even stronger. The extensors, the muscles that open the hand, are still weak, still not active. Sometimes the brain is trying to send a signal to open, but the flexors are dominating and pulling the hand in again. This is the first mistake. We celebrate the movement that we can see and we keep repeating only that movement. We do not respect the movement that is missing. In a moment, I will tell you the exact point where you must stop focusing only on ball pressing and change your plan, because after that point, every extra week of the same exercise actually reduces your chance of full recovery. Think of a classroom. One student is already very bright, another is very weak in studies. If the teacher spends all the time with the bright student and never helps the weak one, what will happen? After 1 year, the gap will become huge. The bright student will fly ahead, the weak student will fall further behind. This is exactly what many stroke patients unknowingly do to their own hand. They strengthen the strong student more and more and abandon the weak student completely. Now let me show you how this looks in real life with the ball exercise. The patient sits with the ball in the weak hand. The family says press, press, press. The hand closes around the ball. There is some movement. Everyone is happy. After pressing, the hand does not open by itself, so the patient uses the good hand to pull the fingers open. The ball is placed again in the weak hand. Press again, then again. The good hand is used to open. Close with the weak hand. Forcefully open with the good hand. Repeat this pattern hundreds of times over many weeks. What is the brain learning in this process? The brain is learning that the only job of the weak hand is to close. The job of opening is given to the other hand. The closing pattern becomes stronger. The opening pattern never gets a chance to build a proper path in the brain. There is one more problem. When the patient tries to close the hand harder and harder, they start to use extra muscles. Not only the fingers, the wrist bends, the forearm pulls in, the elbow bends, the shoulder comes forward, the whole arm is pulled like a hook towards the chest. This is how the classic tight curl stroke hand starts. Day after day, week after week, the flexor muscles become like a strong rope pulling the hand into a closed position. Then one day the family notices the hand no longer opens flat. Even with the good hand, they must struggle to straighten the fingers. The nails dig into the palm, the skin gets damaged. Cleaning the hand becomes difficult. At this point, people start searching for experts and ask how to treat this, how to open this hand. The pain in the fingers and wrist is not the main problem. The main problem is that the brain has been trained for months that this hand should close and stay closed. This is what I call a trained deficiency. You did gain some movement in the beginning, but because the exercise was not changed at the right time, you trained the wrong pattern. Let me give you a real example from my practice. In my clinic in Mumbai, I met Mr. Patel. He was 62 years old and had a stroke on the right side. The hospital gave his family a soft ball and told them to keep him active. They were very sincere. Every day his wife made him press the ball for 1 full hour. 3 months later they came to me and said that recovery of the hand had stopped. When I examined him, his fingers were tightly curled into the palm. The skin inside the hand was red and damp. His nails were leaving marks in the skin. The family was proud that they had done so much hard work, but what had really happened? The weak hand had learned only one job: close and stay closed. There was almost no active attempt to open the fingers. The good hand was always used to pull them open. We had to spend many months slowly reducing the tightness, focusing on gentle opening patterns and training the brain again. This is the future that I want you to avoid. Many people then say that exercise is exercise and it increases blood circulation. Let me be very clear. Neuro recovery and blood circulation are two different topics. Your physiotherapist already does passive movements and other techniques to maintain blood flow. That is their job after they leave. If you do random exercises without direction just to feel that something is happening, you may be disturbing the fine wiring that the brain is trying to rebuild. For stroke recovery, direction matters more than effort. Let us talk about neuroplasticity. In simple language, neuroplasticity means that the brain can learn, relearn, and reorganize throughout life. There is a simple rule that many neuroscientists use: when cells fire together, they wire together. Each time you try to open your weak hand by itself, even if the movement is very tiny, you are asking a new set of brain cells to fire together. If you repeat this enough times slowly, the brain forms a new pathway for opening. But if you only close the hand and then use the good hand to open it, the brain wires closing into a strong highway and never builds the highway for opening. So what should you do instead? First, remember the important point I promised earlier. When your hand can close well around the ball but still cannot open flat by itself on the bed or on a table, that is the moment to stop increasing ball pressing. From that point, every extra week of only closing and forced opening with the other hand increases the risk of a tight curled hand. At that stage, you should discuss with your physiotherapist how to shift focus from closing to opening. Second, understand that strength and control are not the same thing. Many families want to jump quickly into strength training. They buy weights. They make the patient hold heavy objects with the weak hand. But if the brain does not yet have fine control, extra weight only teaches the wrong muscles to work harder. For example, if you hang a dumbbell from the weak hand and try to lift it, most of the time the shoulder and trunk will compensate. You will see the body leaning the shoulder, hiking up the hand, hanging like a hook. This may look like hard work, but the brain is not learning the correct movement of the hand. So first, we must gain quality of movement. Then we can think of strength. Third, never ignore the invisible side of recovery. Pain, fear, frustration, and depression are common after stroke. When exercises are too difficult or painful, patients naturally repeat the ones that feel easier. Pressing the ball feels like success. Trying to open the hand feels like failure. Over time, this creates a habit in the mind as well. The patient avoids the hard movement. and returns again and again to the easy movement. Caregivers must understand this psychology. Instead of scolding, you can encourage gently. You can say in a soft voice that you know opening is harder, and you will try together 3 times and then rest. Small focused attempts are more powerful than long random sessions. Fourth, do not copy exercises from social media blindly. In India, many stroke families receive exercise videos on messaging apps from friends and relatives. Some of these ideas are good, but many are not suitable for the specific stage and pattern of your stroke. A person with very tight flexor tone needs a different approach compared to a person whose hand is completely loose and flaccid. Your physiotherapist and treating doctor know your pattern. Share with them any exercise you see online before you add it to your daily routine. Now let me summarize this in very clear language. If your hand has learned to close, that is good. Celebrate it once, then shift the focus to opening. If you continue pressing the ball hundreds of times while always using the good hand to open the fingers, you are training closing, not opening, over months. This creates a tight curled hand that is very hard to reverse. The earlier you correct this mistake, the better your chance of good recovery. At the same time, do not completely stop all exercise out of fear. The goal is not zero activity. The goal is the right activity in the right direction at the right stage. Always keep your physiotherapist as the captain of your exercise plan. Do not make big changes without discussing with them. Now, I want to give you an example of a safer mini routine that you can discuss with your physiotherapist. This is only a general example, not a personal prescription. Suppose you are currently doing 100 ball presses per day with the weak hand. Step 1. Reduce ball pressing to around 30 or 40 presses per day, done slowly without using the shoulder and without pain. Step 2. Add gentle opening attempts from the weak hand itself. For example, 10 times. Place the weak hand on a table with the palm down and try to slowly spread the fingers apart. Even if they move only a little, count it as 1. 10 times. Try to straighten one finger at a time from a slightly bent position, only as much as the finger can move without force. 10 times. Rest the palm on a towel and try to slide the fingers forward as if you want to make the hand longer. The key idea is that the effort to open should start from the weak side. The good hand can support or guide but should not do all the work. Step 3. Stop each exercise before strong stiffness or pain appears. You should feel effort and mild tiredness, not sharp pain and not heavy pulling into more tightness. Step 4. Repeat this routine once or twice a day based on the advice of your physiotherapist and review progress every few weeks. Again, this is only a sample structure. Your exact plan must come from your physiotherapist after they assess your tone, range of motion and stage of recovery. Now, I want you to think about your own routine. If you or your family member is doing ball exercises right now, ask yourself in your mind, are we training only closing or are we also giving time and attention to opening? If you realize that you have been repeating the same mistake, do not panic. You can start correcting it from today. Talk to your physiotherapist about how to add safe opening patterns. Ask them to show you 1 or 2 simple tasks to encourage extension without force or pain. Then follow that plan slowly and consistently. If this video has helped you understand your hand better, please do 3 things. First, like this video. Your like tells the platform that stroke education in India is important. Second, share this video with at least one family that is caring for a stroke survivor. You may save their hand from unnecessary tightness in the future. Third, comment below and tell me, are you using a ball exercise now? And what is the hardest movement for your weak hand today? I read your comments and use them to plan future videos. My name is Dr. Hartways. Thank you for watching. Do not let a well-intentioned mistake steal your recovery. With the right knowledge, you can guide your brain and your hand in the correct direction over time.